think what we'll do now is move into the panel session. So Nikki, can I ask you to stop sharing your screen at this point? And I just noticed that Karen Mackay's put in the chat, and that might be a good place to start the kind of Q&A session. And I think I'm going to ask that question to Alicia, if you don't mind, Alicia. Basically, Karen's asking about level 4 guidance and adult education face-to-face sessions. And basically the guidance saying that they are only necessary for tasks linked to qualifications and vulnerable adults. Depending on the perspectives, various people who use our services may come under the umbrella of vulnerable. Does this mean that each context must put a request to their own health and safety or public health team via the council? So Alicia, and I'm just thinking, Nikki, you might be able to best kind of share some of your reflections if you don't mind. So Alicia first and then Nikki.
So I would say adult learning in the context of CLD is permitted to take place as part of education in general. Now, with each level comes a higher level of caution, and we would certainly ask people at every level to have increased mitigations in place, including reducing those numbers. My suggestion would be, if you are uncertain, to look at the CLD guidance. There is advice specifically for adult learning taking place, and I would also use that in conjunction with the college guidance, which was updated at the tail end of last week.
Okay, thanks. Nikki, is there anything that you would like to add from your experience in Dundee?
So just to say, we are at level 3 and almost all of our adult learning is currently online. Our ESOL and our adult learning is online. We do have some, especially more vulnerable groups or people less able to get online, who have come in, but we are, you know, it's social distance in very small groups. But we also, when we mapped out our level 4, we would not be bringing people in at level 4. And again, this is our judgment. I'm not saying this is exactly what you're meant to do or not, but we decided at level 4 we just couldn't bring learners in. But everything that we do needs a risk assessment, and we've been supported by our health and safety colleagues to do that.
Excellent, thank you. Karen, thanks, I'm glad to see. I hope that helps answer your questions there. I'm going to move on now, because one of the kind of main questions that we were asked when we asked people to submit questions was in and about balancing that risks and planning for service delivery. So how best can we make sure that we are adequately balancing risks and planning for delivering our services? So I'm going to ask Lisa Martin, Public Health Scotland, if Lisa, if you would mind taking that question first, please.
Hi, Marion. Can you guys see me okay? Yes.
Yes, I can see you.
Oh, brilliant. Okay. I think just to introduce myself briefly, my name's Lisa Martin. I work for Public Health Scotland. I sit within the community development portfolio, and myself and my colleague Mick Doyle from the Scottish Community Development Centre have co-produced a resource called the Supporting Community Safely resource, and that is advice and support that is predominantly aimed at the third sector, community organisations, volunteers, community networks, activists and so on. Many of the people who CLD practitioners will be supporting and will have been supporting throughout the course of the pandemic. Just in relation to that question about balance and risk, it's a very difficult one, it's a tricky one, and I'll invite Mick to join and jump in on this as well. But I think what we've heard from the speakers already is that there is guidance there to underpin some of that decision making, but it's a balance between looking at the guidance and trying to find your way through what is appropriate and relevant to you, and then also thinking about that in the context that you are operating in, the context that your service is operating in, the context of the activities that you provide, but also where you are in the country, what the current level of protection tier is, for example. So we just heard from Nikki about being in tier 3 and some of the things that they have and haven't been able to do, which will be very different to some of the central belt areas, for example, where in tier 4 there is a much higher level of restriction and there are limitations around what people can and can't do. What we've said in the Supporting Community Safely resource is that you have to take everything into context, not just the actual service that you're providing, but we encourage people to think about the broader community as well and the impacts. It has to be underpinned ultimately by reducing every opportunity, reducing the possibility of infection transmission. And that's ultimately what we're about, particularly at this critical time, as we heard from Dr. Harden, when infection levels are rising, positive cases are rising, and that's resulted in us being in the situation that we are at the moment, where we have different levels of restriction across the country. But what I would say is that, echoing the point that Alicia made, if people are uncertain at any point about whether they should or shouldn't be doing anything, we would advise you to stop. Within the Support and Community Safely resource and the conversations that we've had with community organisations and groups, in some cases we are just not recommending that people start anything beyond planning to reopen services and thinking about the planning stage, because that's the critical point, putting in place and making sure that you've got those mitigations that Dr. Harden was talking about around risk assessing, the other mitigations around physical distancing, cleaning and disinfection, and supporting your staff and volunteers, making sure that you're going to be complying with some of those key messages that are in the strategic framework, and that includes things like, can you comply with the test and protect regulations? Do you know how to do that? Lots of community groups and organisations are also employers, so they've got responsibilities to think about how they're supporting their staff and in particular their volunteers as well. So it's back to that bit of, if you're unsure, take a step back, stop and think about the planning of it in the first instance and seek advice. Look at the Support and Community Safely resource. I would strongly advise people to do that. What we do there is we distill down some of those key messages. We use the guidance that's there to underpin that, but what we also do is we try and break it down a little bit and give people some operational advice as to how they can put procedures in place. So we tackle particular things like, how would you maybe put in a comprehensive cleaning and disinfection procedure? What can you do to support physical distancing? What are the requirements around face coverings and so on? So that resource gives practical advice and support. But again, go back to your local health protection teams and go back and review the guidance that's in place as well.
Thank you very much, Lisa. I'm actually going to move on now. I'm just conscious of time. 10 minutes to go, 4 questions out of 400 to try and cover. So the next question was really quite straightforward, but again, there was a lot of concern just about resources and funding, as there usually is. So quite a straightforward question. And again, Alicia, I'm going to come to you first. Is there funds available to help with the recovery, to deliver services and to help with recover? What funding is available? Alicia, can you give us an overview, please? Have we lost you, Alicia?
Almost. I have network problems this afternoon. So funding available. Scottish Government has released a range of funds in relation to COVID-19. We have the £350 Communities Fund, which is supporting wellbeing and supporting communities, a whole lot of activity taking place across that. And that's recently been sort of topped up with another £27 million funding pot under SCVO, which is open at the moment. They've released support for digital, financial support to local authorities, £100 million for education recovery, and part of that is a £3 million education recovery for youth work. So in short, yes, I think the Scottish Government has produced quite a wide range to try and take into the context how people have been affected by the virus and how they will continue to be affected to help to try and restart things again.
Brilliant. Okie dokie, thanks very much for that, Alicia. I'm going to move us on to the next question. How do CLD partnerships and Scottish Government plan to work together to address recovery in CLD? And in and around this question, there was a lot of issues raised about vulnerable learners. So I'm actually going to ask Marielle Bruce from YouthLink Scotland if she could answer first, and then pass to Jackie Howie, before again coming back to some of our colleagues in SG. So Marielle, I'm throwing the ball to you.
Thanks, Marion. I'm catching it without looking because I've got dodgy internet here this afternoon, so I'm just going to keep my camera on, so apologies for that. Ensuring access to provision for vulnerable young people. Well, I think from a youth work perspective, the youth work sector's made a really good use of blended approaches. So when we went into lockdown, organisations were using online and remote approaches to engage young people and their families, use social media to reach out, providing them with information, live sessions, and they've really continued that. So, we have managed to engage young people who would not normally have engaged with youth work services because we've been using digital approaches. And even once youth work was able to begin face-to-face youth work, these online and digital approaches have continued. And I think especially for organisations in levels 3 and 4, it's helping to get that balance between providing a service for all young people whilst also targeting the face-to-face work at young people who need it most. There's been a whole range of different approaches used, throughout the sector. So continuing that one-to-one support, doing walk and talk kind of sessions, detached youth work approaches, outdoor learning, making really good use of outdoor learning. And, I think it's obviously becoming more and more difficult, but we've seen youth work organisations at the sensitive communities at the moment, securing winter clothing, kind of drops for families that really need it. But for us, what we're seeing is that partnership seems to be the key to providing services for the most vulnerable. So the sector really, coming together, local authority CLD teams and third sector community-based organisations really working together to identify learners who are in most need of that face-to-face support and to help them overcome some of the challenges where, a community centre might not be open, but we might have a local third sector organisation who's got premises. So really kind of looking at how we can work collaboratively to make this work for learners.
Brilliant, thank you. Jackie Howie, is there anything that you would like to add to that, please?
No, I won't add too much because of the time, Marion, but I would just say that there's some national partnerships as well that are supporting the sector. So the reference group that was put together to support the minister, Alan feeding into the minister, that developed the guidance is probably going to be an ongoing group to support the sector going forward. So, yeah, good work.
Great, thank you very much. And Alicia, just about how do CLD partnerships and Scottish Government plan to work together to address the recovery in CLD? Any comments?
Just that obviously partnership has never been more important than it is just now, and partnerships across government are taking place more and more in the context of CLD. So one of the things that we are doing at the moment is developing the CLD guidance note for the CLD plans that are being created next year, and we would fully expect all of this work from right across government to be reflected from within that.
Great. Okay. I am there's one more question that before we do the roundup, I'm going to ask Mick Doyle. Mick, straightforward question. How best can we advise groups?
Well, I put something in the chat just now, and it's related to the balance of risk, really. I think it's now in November 2020, I suppose my view would be that we know that risk is increasing. The rate of increase might be leveling out. We know that risk is increasing, and that's why so many of us are now in Tier 4. And I guess a big question that we would ask folk is, do you think that what you can do now is absolutely safe, or do you think that it's worth waiting a little longer and persevering with the online methods and the other non-face-to-face approaches, whilst you put a really systematic approach of thinking about risk in place? Section 13 of our Supporting Community Safely resource, which we are updating, but it currently asks a lot of kind of challenge questions to ask yourself, about making sure that your approaches are robust, they're sustainable, and that they're systematic. And a lot of the things that make that up have already been said about thinking about whether people are vulnerable, whether places create vulnerability, and whether the actions of others create vulnerabilities. But at the moment, I think on balance, our kind of core message, and I know this is the same for Scottish, for SCVO at the minute in their work, is that you need to think really carefully before you would reopen anything at the moment, and you should be looking very carefully at anything that's currently open in order to ensure that it's still safe. So we want to balance the four harms. We know that a lot of the actions that we do are really important for people's lives, and that there's no way that anybody would say that they're not. But the one that can kill in the short term is the virus itself. And I think that needs to be the short term lens, certainly in the higher tier areas, and that everybody should be coming towards a process of risk assessment that is really robust. And for folk out with the public CLD sector, it's really important to understand that people don't always have the resources that public sector colleagues do. It's harder for them to do that. So the more we can do to get good, strong, congruent messages across the guidance and give people the tools to make the guidance accessible to local folk organising their own activities, the better.
That's great, Mick. I'm conscious that that's us, almost time up. We've got 2 minutes to go just before I ask our panellists for just one last word. I would remind everybody that there's some more sessions next week that I've got a focus on youth work, adult learning and community development. So check out all the usual kind of social media outlets to keep the conversation going. So just quickly, and you have one word because I will stop you, I will be absolutely brutal. I'm going to ask you all just to think of one word to shape what you think the next steps, what the future is going to be for us in the next 6 weeks. So Marielle, what's your word?
Cautious.
Cautious. Jackie Howie?
Equally cautious. I'm in level 4 area, so it's definitely supporting caution.
Caution, caution. Mick Doyle?
I think collaboration. I think we've got a bit to do to make sure we're pushing the same messages.
More than one word. Lisa?
I think my word would be informed, about trying to make sure you're as well informed as possible when you're making decisions about how you deliver your service.
Brilliant. Nikki, one word.
Plan, model for the different levels, don't be reactive.
Brilliant. So that's us, bang on 4 o'clock, people. Thank you very much for taking your time. Your words, your takeaway words are cautious, collaboration, informed and plan. Lovely to see you all virtually and hear from you all virtually. Keep in touch, keep coming along to the seminars and keep up all the fabulous, fabulous work. I'm so proud to be part of the CLD sector. So hopefully speak to you all soon. Take care. Bye.